Welcome everyone. Thanks so much for coming. Actually, I was expecting like 10, 15 people in this course, but there's so much interest and some people are even in the wait list. So thank you so much for the interest in my course. This is the first time of me teaching, so I guess it'll be experience for both of us. So yeah, medical terminology DeCal. That's what you guys signed up for. And today we'll start with like the introduction and kind of like why we need to learn medical terminology and the basics of like how is a medical term like defined, what are the components, and just a review of the syllabus to let you know what's ahead of for the rest of the semester. So I'll start with myself. I'm Jaewon. I'm a fourth year studying in molecular environmental biology, which is a major in the College of Natural Resources. And why did I decide to teach this course? I believe the foundations in medical terminology is extremely critical and practical in whatever field you will be end up, either healthcare, medicine, or biological research. It will be very helpful in understanding the terms you never encountered, or even if it's the terms you already know, it might help you define it better. So I feel like it has very strong potential. Like I actually learned this course from a community college before, and it is probably like the most practical and useful course I learned after coming to college. Sorry to say, but even then Berkeley courses, I felt like it was a little more practical. Um, I guess I can share my hobby. I volunteer at like a pop-up vaccine clinic for dogs and cats. Oh, um, Cashby there is also knows me, like that I go there a lot. I've been there too. Yeah, it is awesome. I think there's one coming like this Sunday too. It's very nice. If anyone's interested, let me know. Uh, yeah. So that's one of the picture of one of the dogs I got to give vaccines on, and the one I'm holding, I think that was like only like 4 weeks old. It was very young puppy. Uh, so I guess it's your turn now. Since there's like more people than I thought, I must skip the hobby. I think I want you guys to skip the hobby parts, but maybe share your name, year, major, and why did you decide to take this course? Because it's a DeCal and it's kind of like an elective that it's not a requirement, but yeah. So yeah, do you want to start and like you can go like zigzag like that? Yeah.
Hi, my name is Shanae. I'm a sophomore. My major is integrated bio, and then I took this course to prepare myself for future ones. My name is Mia. I'm a sophomore also. I'm a neuroscience major, and I decided to take this course because I am a student. My name is Jamie. I'm a first year, and the major I want to take is NCB. I decided to take this course to do my response to learn more about my My name's Maya. I'm a third year. I'm an integrated biology and public health major. And I decided to take this course because I'm a licensed veterinary technician, or I guess a veterinary nurse. And I work with a lot of animals and write a lot of exams. So it would be nice to understand what I'm writing. I'm Lily. I'm a freshman. My major is undecided, but I decided to take this course. I'm interested in that.
My name is Brian. I'm a senior. My associate's degree is in firefighting, but I'm studying psychology for my bachelor's. I'm taking this course because I'm an EMT. I want to get
Vivian. I'm a fourth year MED major and public health minor. And I decided to take this course because I'm taking human anatomy right now, because I think it will be really helpful to commit a lot of the terms to memory. My name is Holly. I'm at a first year. My major is neuroscience, and I decided to take this course because I'm interested in anatomy and medicine.
I'm Josie. I'm a fourth year MED student. I want to take this course because now I have a lot of free time. I have one more unit left to build, so we can do this.
Yeah, that's what DeCal is for.
Yeah.
Ashley, I'm a senior, majoring in microbiology, and the course looks interesting. Sorry.
Maxwell, I'm a second year. My major is microbial lab. I want to get an EMT certificate, so I just decided to.
Yeah, you can take a seat wherever you want.
Hi everyone, I'm Alex, senior. I also major in nutrition, and I decided to take this course for practicality for future programs.
Hi everyone, my name is Ashley. I am a senior sociology major, and I'm taking this class because I'm currently working as a medical assistant, so it'd be nice to know a little bit more medical terminology and then for future careers.
I am Maria. I'm a third year. My major is MCV in neuroscience, and I decided to take this course because I want to go into med school and I want to learn more about it. Hi, I'm Vicky. I'm majoring in psychology. This course because it also supplements IB 131, which is anatomy, and I'm also super interested in it because
Hi, I'm Fernando. I'm a third year. I entered supply side, but I'm interested in medical malpractice.
I'm Brooke. I'm a fourth year.
I'm Jamie. I'm a first year. I'm actually a data science major, but I'm really into medicine and I want to do something.
My name is Rithik. I'm a sophomore, and integrated bio major, and I decided to take this course because I'm going to pre-med lab.
And my name is Derek. I'm a third year in MCB, and I'm also in the pre-med field.
Hi everyone, my name is Andrea. I'm a third year and I major in sociology and I minor in public health. I decided to take this course because I thought medical terminology could be interesting.
Hi everyone, my name is Diana. I'm a junior and I'm an IB major. And I decided to take this course kind of similar to you, just because I thought medical terminology could be interesting.
Oh, you two wanna
Yeah.
go ahead?
Hey, I'm Karishma. I'm a senior. I'm majoring in MEB and French. And I took this because I'm pre-med and I need some more units.
My name is Elizabeth. I'm a senior. I'm majoring in observation and research studies, and I took this course because I'm interested in going to the nursing school.
I'm Alice. I'm a junior. My major is neuroscience. I decided to take this course to understand medical first.
Hey, I'm Ernesto. I'm a rising senior. My major is MCV. I'm taking this course. I'm just here so I don't get fined. That's not a joke. I'm taking this course just because I needed an extra couple units to fulfill financial aids.
My name is Kashti. I am a senior as well. I'm a major. Took this course I needed 2 more units to graduate, and it's a requirement for 2 vet schools.
to taking this course because I'm looking to go to
Okay, thank you so much for sharing. Yeah, I heard a lot of like interesting like pre-med routes, and also some people like in like different fields that are just like genuinely interested in like what medical terminology is about. That was like interesting too. I thought everyone's gonna be pre-med, but so I noticed like some people are interested in like a veterinary field. This course will mostly cover term that's related more to like human medicine, but as I said, like the name of the bones or like the muscles, like those kind of like the terminology itself applies the same for animals as well as humans, so it'll still be applicable. And but one thing I know like some of you might be taking this for requirement, like a prerequisite for the graduate school program, such as nursing school, physician assistant school, or veterinary school. This is a student taught course, undergraduate student taught course, and I'm afraid, I can't say for sure, but I'm afraid it might not be accepted as a proper course taken for letter grades to fulfill the requirements for some kind of medical terminology course, if there is such one. So just a quick disclaimer, if you are thinking of using this course as such reason. But still, I think medical terminology is a very practical skill, and I do really want to teach it because I noticed there is no medical terminology course taught in Berkeley besides the Berkeley extension, which is fully online, and they recorded like 10 years ago. So it's just like kind of like watching a YouTube video. So I hope you guys enjoy my course. I'll start with why we want to learn medical terminology. I touched a little bit, but we can get started with some fun stuff. So who here can read this term and maybe kind of like have a guess on what this means? Anyone? Yeah? Yeah. Yep, correct. And that was just even hard to read by itself, right? It just sounds like wrong words. And how about now? Does it get better? Probably not that much, but you can kind of see, like breaking it down, maybe each of those terms have like meanings to it that's different from the other ones. Anyone have a guess on like any of the terms that's like divided by the slashes? Yeah? Yep, something in the lungs. Anything else, Alex?
Silico is like rock or glass.
Mm-hmm. Yeah, rock or glass, like sand, dust. Anything else? Yeah.
I don't know how volcano fits into it, but if it's pneumo and then microscopic silico and then osis is usually like medical condition, then some kind of inhalation of microscopic silt, I think.
Very good guess. It's a very misleading term. I'll like explain all the definitions later.
But I don't know where volcano.
Yeah. I think they just wanted to mean like some kind of dust that forms like, you know, like after volcanic eruption, like the volcanic ashes like kind of like covers the whole sky, and like you might inhale that and that could like cause some problem. Kind of like that. It's, I don't think they mean the volcanic ash, but something like that. Yeah. Good guess. Good guess. It was more literal in this case. I think there's like a use of those in that like meaning too. Yeah. Anyone else? Okay. Let's see what they actually mean. So the first one, pneumono, is from ancient Greek roots. So a lot of medical terms are from Greek and Latin origin. We'll actually have a guest lecture later into semester, I think like week 3, who is from like a Greek and Latin departments, and she's very like knowledgeable in like medical terminology. So that would be interesting to learn like the kind of like historical aspect into it. But yeah, usually a lot of terms in medical fields are like mix of Greek and Latin. It's kind of like based on like back then, like from the literature, if this was defined as pneumono, they just decided to keep using it instead of like defining a new one. So some of them might sound like very misleading, but it just became a rule that now everyone just has to follow because it's just too complicated to like make a new rule now. Well, anyways, like that was a side talk, but pneumono, as I said, means lungs. Ultra, from a Latin origin, it means beyond or like higher. So microscopic means microscope, just like looking at small things. And silico is referring to like the silicone, which is like primary component of like sand, but more generally, it kind of refers to like a dust or some kind of like ashy stuff that's like floats in the air. Volcano, it refers to volcano, but I'll later show like the full definition. It's kind of more of a dust it is referring to. Conio also means dust. Osis, I think you mentioned that it means a kind of like a medical condition, just in general, not a specific one. So this apparently is the longest word in the English language published in Oxford Dictionary. And they probably made it on purpose, as like the term is defined as an artificial long word said to mean a lung disease caused by inhaling very fine ash and sand dust. So they could have just said pneumonosis. That could have been fine too, but they just really wanted to make a long term and decided to know this. So don't worry, the purpose of this course is not to interpret this long word. This is just like one example to kind of like get you through like knowing that, yeah.
I'm sorry, you can go first.
Oh,
This is
no, 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 no.
topic.
No, feel free to.
This is very off topic, but do you know by any chance, like, if there's a rule that determines the order of the prefixes?
Order of the prefixes. That I do not know.
Okay.
But I think there is for certain ones and not for the other ones. It's kind of like, as I said, if it was like defined previously like that way, it just stick like that. And back then they didn't really like follow the exact rules or something like that. Like whoever defined it first, kind of like it goes with that.
So it's not like chemistry nomenclature. It's
Oh no.
Okay.
It tries to, but not as like defined as like that. Yeah. So as you just saw, like that long over term kind of gets easier to understand if you like break it down to like its components and their meanings. So I think learning medical terminology is very like useful to you because it can help you get stronger communication skills to avoid miscommunications and have concise yet effective discussions with the professionals in the field. I remember one of you were a medical assistant or like an EMT in like this like fast-paced clinic or like a emergency setting, like making a communication that refers to specific thing accurately is like very important. You might be referring to one thing, but the other person was thinking it was the other thing, and that could create a very big problem if it is some kind of emergency. Also, I think it is very relevant for like academic research as well, because a lot of like terms like immunology, lymphoma, sarcoma, carcinoma, those kind of things all are based on medical terminology too, but those are like very commonly used in the research fields. And if you don't know about it, you probably have to search up every single one. And hopefully this makes it easier by not having you do that. Also, I think it will be very helpful for gaining a skill that boosts your competitiveness for the jobs, internships, and research roles in medicine and healthcare in general. Yeah. So I'll get started with the word parts. So disclaimer, this is probably like the most important lecture this semester, because this is like the basics of how like medical terminology is made, and everything will kind of like base off from it. So like a usual medical term has 3 different components, which is a word root, which contains the basic meaning of the term. Oh, by the way, I have like this slides published somewhere in the B courses. I can make an announcement afterwards too. So you can like download that if you want to refer back to it in the future. Yeah. And also I'll record this lecture and like have like a YouTube link sent out as well. So the word root contains the basic meaning of the term. So remember pneumono, lung. That's one of the word parts. It is like the kind of like the core definition of like the certain term you're looking for. And combining form is a kind of like variation of that word root. So therm over here, which means heat, that is the word root. And when you add a slash and O, which will kind of mean you can like use as like a therm or thermo, like in the term itself, that will mean combining form, which is a form that can be used to combine with the, I will explain later, but suffixes or prefixes, or even other combining forms. So the word root defines the meaning, but usually the ones you will encounter will be the combining forms. Yeah, and the example, as I said, was the therm slash O. And the suffix, we'll probably kind of like be able to guess by the name of it. Suffix comes at the end of the words. It has a hyphen to the left of it, and the suffix later words. So I will get to it too, but it usually means some kind of like condition, or it can turn some kind of term into a noun or adjective. So it's more like a accessory role to the term. And there is also a prefix which goes at the very front, or it can be in the middle too, depending on like how the term is structured. So, but usually at the very beginning. And with a hyphen after, for example, like hypo, which means below normal. And sorry, I should have explained it, but ia is one of the suffixes. It means condition. So if you want to create like a very simple term from here, we start with prefix hypo, and then the combining form thermo, and then add the suffix afterwards, ia. So hypothermia, that's one of the terms that means obsessively low, abnormally low body temperatures, particularly below 35 degrees Celsius. So these 3, I guess, like components of the medical term is what we're gonna like keep like repeating again and again. Every time you see a hyphen after, that means it's a prefix. Hyphen before, that's a suffix. And the slash and O, that means it's a combining form. So we can go through some examples. So these are some examples of combining forms that describe color. So cyano, blue. Cyano means blue. And an example is cyanosis. Has anyone heard the term cyanosis? Yeah, I see some nodding. So it means the blueness of the skin due to lack of oxygen. So cyanosis, the combining form cyano, plus the osis, which also means some kind of abnormal condition. that combine together. Cyanosis means, yeah, the blueness of the skin due to lack of oxygen in the blood. So you can kind of tell by like the color of the lips, you know, like when you're very cold or also very like low on oxygen, your hemoglobin color is determined by like how much oxygen is like bound to the hemoglobin. And if it doesn't have that much oxygen, it will appear blue. You might have noticed like your lips appearing blue sometimes. That is also called cyanosis. So erythro, which means red, is a combining form. And example is erythrocytes. And it is made by combining form erythro with the suffix cyte, which means cell. So erythrocytes, red cell. Might have guessed it, red blood cell. Just the normal oxygen carrying cells that is in our body. So leuco, leukocyte means white, it's combining form. Leukocyte is an example. And you combine leuco with a cyte again, which is a cell. White cell, white blood cell, leukocytes. And John Doe is a combining form for yellow. So have you guys heard the term jaundice before? Yeah. Does anyone know like what the jaundice? I guess. Oh, I think it kind of says on the slide, but why does it happen? Yeah. That was very detailed. Yep, exactly. So liver is the one that breaks down the, I guess, defective or like used up red blood cells down into bilirubins. I mean, no, I might be wrong, but bilirubin is like created too much if the liver is not doing well during the breakdown of the red blood cell. So, and bilirubin has like a yellow coloration to it. So if you have too much of it, it'll like circulate around the body, and usually tip of your like fingers or your usually very like commonly your eyes turn yellowish. That's how you like how like a physician's without like testing anything can tell, yeah, this person might have like a liver damage. And I'll introduce some suffixes. These in the table, you don't need to memorize them. We will like bring it up again and again, and I will explain later, but you only need to know the ones that are either blue colored or which are just like the complete terms, and the orange colors, which are the components of the words, which are combining forms, prefixes, suffixes. You only need to know the ones that are colored blue or orange. These ones, I just want you to know for like a reference. So suffixes can be multiple things, but the most common uses are used as a noun endings. Some example are us, why, and it can also mean pertaining to, like pertaining to lung, pneumono plus al, pertaining to lung, kind of like that. All these suffixes can like take that role, and suffixes that describe any kind of like abnormal condition or disease. Osis, we just covered like with the pneumono ultra, I forgot, that long term, that was osis. Pathy is also one. Ia, we just saw with the hypothermia, kind of like that. Those suffixes can mean abnormal conditions or disease. So yeah, some examples that can act as a noun ending to turn a term into noun. Cranium. Cranio is a combining form that means your skull. And if you add the noun ending suffix to it, cranium, it becomes just a skull. Cardiac, oh, sorry. So suffix also can be used to turn term into the meaning pertaining to, which kind of makes the term adjective. So cardiac, cardio means heart. Suffix "ac" means pertaining to. So pertaining to heart, or cardiac arrest, kind of like heart-related something. Also, as I said, it can be used to describe a normal condition. Gastrosis, gastro is a combining form that refers to stomach. Osis, condition, so gastrosis, a normal condition in your stomach, or disease of the stomach. And another suffix that's commonly used is a study of, which is the suffix ology. So neurology, combining form neuro, which means nervous system, combined with ology, neurology, the study of nervous system. You might already kind of like know about this one a lot, like neurology, pathology, like oncology, rheumatology. Those all mean like study of something. So these are some suffixes that can mean specific conditions. That's not just like general abnormal condition. So algia is a suffix that means pain and suffering. And one example is gastralgia. We said gastro is a stomach, and algia, pain and suffering, so stomach pain. If you want to use medical term, it will mean, yeah, gastralgia. And dynia is just a pain. So the difference between algia and dynia is algia is more like objectively that person is like suffering, is having a pain. Dynia is more like that person is having like a symptom of it. Like that person says like, I'm having like a stomach pain. That's when you would use like a dynia. Gastrodynia, gastro in stomach again. Dynia, pain in the stomach. This one you might have heard a lot. Itis, suffix itis means inflammation, usually due to some kind of infection. Infection causes your immune system to be activated, and that will cause like inflammation. So gastritis, gastro part plus itis, inflammation of the stomach. This one I actually didn't know until I decided to teach this course. Malacia is a suffix that means abnormal softening of the tissue. So usually of like the muscles. So kind of like the muscles like deteriorating, it will get like softer rather than harder. So arteriomalacia. Arterio is a combining form that means artery. So that combined with malacia means abnormal softening of the walls of an artery or arteries. And some more terms that refer to specific disease conditions. Necrosis is a suffix that means tissue death. Usually happens due to like a bacterial infection. Arterionecrosis, again, arterio was artery combined with necrosis, tissue death of an artery or arteries. Sorry, I might have said wrong. It's not usually due to bacteria. I'm just thinking of like the necrotizing fasciitis, but it can be, yeah.
What is the ending for cis? What does cis mean?
So the cis part that like is common on all these.
This is a cis part, yeah.
I think it kind of comes from the osis, the abnormal condition. This one we went over. I think I don't know the exact root of it, but I think that the necro was like some kind of term before, and they combined with the osis to make like a.
Black, which is tissue death turns black.
Oh, is it?
Yeah.
Oh, you should teach the course. Oh my god.
I just was wondering if I get it now.
You didn't know? Yeah. Actually, please let me know. Like, I'm curious too. What's like the root for it? Yeah. So another, just stenosis is abnormal narrowing, which is a prefix suffix used like mostly for cardiovascular related problems. And yeah, and the example is to arteriostenosis. Artery gets abnormally narrowed. Stenosis, abnormal narrowing of artery or arteries. Suffix ria means flow or discharge. Probably the most famous case is the diarrhea. Dia is a prefix that means like through or out. I guess through is more correct definition. And ria, flow or discharge. So frequent flow of loose or watery stools. And suffix rage means bleeding. So hemorrhage. Hemo means blood, and rage, bleeding, like blood bleeding, probably a lot of bleeding then. Loss of a large amount of blood in the short time. So we can cover some suffixes that refer to medical procedure, like a surgery that's done on like patients. Refi, suffix refi means surgical suturing to close a wound. So tenorrhaphy. Teno is a combining form that means tendon, and combined with refi, surgical suturing of a tendon. And also feel free to stop me anytime if you have a question. Yeah. And ostomy. So the last three might be very confusing. Don't worry, I will not like never test you on like the differences between them. It's very similar term, and I don't think anyone like really is very like specific on like the distinction between them. But ostomy is a surgical creation of an artificial opening to the body surface. So you might have seen like some people have like a food bag like hanging out of their like intestines, like they had to like put a hole through because their digestion systems are not working. Those will be like a ostomy kind of like surgery. So colostomy. Colo means colon, and plus ostomy, surgical creation of an artificial excretory opening for your poop bag. That would be what that is. Ectomy is a surgical removal of something. So appendectomy. So appendix is an organ that's attached to your small intestine, and append plus the ectomy means surgical removal of the appendix. Otomy, which also sounds like very similar, is surgical incision. So this is not the removal of something, you just make a cut on something. So lobotomy, lobo means brain lobes. Otomy, you make a surgical incision to severe connections in the frontal lobe of the brain. So left lobe and the right hemisphere usually are connected with like a tissue nervous system. And I might be wrong, but it was a very like a unethical thing. Like back then, people used to do like lobotomy. Like if someone has like a psychological problem, they would just like make an incision between the left and right lobe. Their interactions between them are very important to like your brain function. But if you cut them, you're just kind of like brain dead. So it'll become quiet. You won't cause any trouble anymore. So people thought that was just like, yeah, they're doing fine. Like their mental problems were solved. But no, it was just it kind of like fucked up the person. But yeah, that's lobotomy. And another medical procedure, synthesis, is a surgical puncture to remove fluids. It's a suffix. And abdominocentesis, abdomen, plus synthesis, surgical puncture of the abdomen. If your abdomen is filled with a fluid, like a pus or some kind of fluid that should not be there, you'll make a puncture to remove those fluids. Graphy, process of recording. Angiography, angio means blood vessel. And graphy is the suffix. So process of producing an X-ray of blood vessels. Yeah, and gram is basically the result of graphy, pictorial records of something. So angiogram, after you do angiography, what you get is a angiogram, the resulting film produced by angiography. Plasty is a surgical repair. Kind of like you can think of it as like a plastic surgery, kind of like that. I don't think it's the same root, but that's like a way to memorize them. Myoplasty. Myo is a term that means muscle. I mean, the combining form that means muscle with plasty, surgical repair of a muscle. Scopy, you might have heard this one a lot, is a visual examination of something, like colonoscopy, like arthroscopy, which is example here. You can actually visually examine the internal structure of a joint. I actually didn't know like that was possible, but yeah, arthro is a combining form that means joint. Scopy, yeah. And now we'll move on to some prefixes. Okay, I might drop a lot of things today. It's not gonna be this intense usually. I just feel like these are the ones that will help like understanding of like the future lectures. So it might be a lot, but there's not gonna be like a test or anything until like the very end. So don't worry about like memorizing all right now. So pro is a prefix that means before, forward. Prokaryotes. It does say definition there, but does anyone know what prokaryote is? Yeah, probably all took like a biology course, high school. Prokaryote versus eukaryotes. We're eukaryotes, like bacteria, they're prokaryotes. And what they have in common is they don't have a membrane-bound nucleus. Their DNAs are just like floating, maybe in like a packed in a circle. So pro prefix plus karyo, that combining form means nucleus. So prokaryotes is an organism lacking a membrane-bound nucleus. That's their definition. Prognosis is another example. So pro, again, before forward, plus nos-o, which is a combining form for knowledge, is another noun ending that turns the term into a noun. So compared to diagnosis, prognosis is a prediction of a probable course or the outcome of a disease. So usually a lot of times like you make prognosis for like a cancer, like someone is having like a very serious cancer, your prognosis is not good, like could be something said. Pre is a prefix that means before. So prenatal, nate is a combining form, or actually I was supposed to add a slash and o next to it, but it's a combining form that means birth, and al means pertaining to, turns an term into adjective. So it's the state of time and events before birth. So before birth. So post is an opposite, post after. Postnatal, after the time and events after birth. And these are some prefixes that refer to location of something. So exo, which means out of something. Yeah, probably all the stuff here is kind of like intuitive. Just you might have seen it like a lot and a lot, but I'll still like go through. Exocrine, so out of, crine, to secrete something, and e is a noun ending. So it's a gland. Those are glands that secrete out through the ducts to your external area. Like example could be like the bile ducts. Those release the juice into the small intestine instead of your into system. So that's a exocrine. Endocrine, on the other hand, endo, which means within, are the glands that secretes internally to your body, specifically to your blood, which is hormones, you know. I guess more accurately it should be like exocrine glands that are glands, endocrine glands, they're glands. My bad. X is a prefix that also means out of or outside. I just list them, but because like these ones are like the things that get confused a lot. X C2, so C2 means a place. So out of the place, out of the original place they're in. So outside the natural location. So let's say you're doing an experiment of this one cell in like a mouse. You take it out and bring it to your lab and research it. That's XC2 because it's outside of its original body location. In situ, in is a prefix that means in or into. It's the opposite. In situ, it's in the natural location. Those cells that are in the mouse, you're studying the mouse, then it's in situ. In vivo, so vivo is a word root that means life. So you're in life. So you're looking at it in the living thing while it's alive within the living body. But if you take out of the living body, it might still be alive. Like you made like a cell line and like you want to research them. It would be taken out of it, and in the glass, vitro, which is the word root, in vitro would mean outside the living body in glass. So usually any experiments done in the lab are in vitro, unless you're like working with the real animals or the organism or human. Yeah. So I'll just stop here and like any questions? Everything good? Okay. These are some more prefixes that refer to location. I haven't seen them being used a lot, but there's terms that refer to right or left side. Dextro means the right side. Sinistro means the left side. And one example could be dextrocardia. So cardi, we covered, it means heart with a noun ending. So it's a condition where the heart is located on the right side. So usually your heart is like here, but in the perspective of the person who has the hearts, it'll be shifted more to the right side. Then it will be called dextrocardia. Sinistrocardia is the opposite. Your heart is abnormally positioned toward the left side than where it's supposed to be. Inter prefix means between or among. Interstitial, so stitial is a word part that word root that means space. So interstitial, between but not within the parts of a tissue. So it's between the space between the tissues. So kind of like in between, yeah. Intra, within or inside. So intramuscular. You start with the prefix intramuscule, which is kind of intuitive, muscle, pertaining R, which is pertaining to. So intramuscular means you're looking at within the muscle. Usually this term is used for some kind of like injection or like treatment you give, like intramuscular injection. Like a lot of vaccines are intramuscular. And these are some prefixes that refer to direction of something. And this is like probably the most confusing ones for me, the top two. The ab is a prefix that means away from something. So abduction, so duct, that part means to lead. Eon, some kind of process is referred to as prefix eon. So abduction, you're moving away from the midline. Usually it's more relevant in like anatomy, like when you're moving your bones or muscles away from you, that's abduction. And ad is a prefix that means toward, to, or in the direction of. So adduction is the opposite. You move toward the midline. You move toward yourself. So midline is basically kind of like if you draw a line like around like the very middle of the human, like in this perspective, that would be the midline. So some easy mnemonics is adduction. That add part is kind of like addition. So you're like adding it towards yourself. That might help you like memorize it. Adduction, abduction. Sub is a prefix that means under, less, or below. So subcostal, one example. Coast means rib, your rib cages. Al pertaining to, so pertaining to below a rib or ribs. So let's say this might be easier to. Oh. Okay, I'll just do it here. So let's say like I'm very bad at drawing, but let's say this is like human. Yeah, do you know how to? It's fine, it's fine. Yeah, I'll just figure it out later. Yeah, let's say like this is like a human rib. Probably like heart is somewhere here, and like your head is here. And subcostal, so these are the ribs. Subcostal will be region here. And the other one, supracostal, like above or excessive, will be above the rib, which kind of goes for same for each one. So people would usually refer to like subcostal region of fourth rib or something like that. I kind of forgot the exact term for it. Then you refer to the fourth rib below that. Yeah. These are some prefixes that refer to amount of something. Hyper, hypo, probably have heard a lot about it. Hyper means excessive, increased. So hypertension. Tension is the same tension we know, like the pressure of something. So high pressure, high blood pressure, hypertension. Usually it's defined as higher than 130 or 80, 130. So the reason there's like a slash in there is so when the heart pumps, it's called systolic motion. Since like heart is pumping right now, probably a lot of like pressure into it, as like all the bloods are getting injected really fast. So it's a high one. So 130, that's the high pressure. And the diastolic is when the heart is relaxing after that huge pump, when the heart comes back to its location. That's the pressure what the diastolic is referring to. So I usually use this mnemonics, sky down. Systolic, sky is high, so systolic is high pressure. Diastolic is the down, so like low pressure. So higher than, yeah. So that would mean like 130 systolic and 80 diastolic pressure. And usually the normal range for like typical people, it varies by people to people. So it's kind of important to see like that person's like previous like records. But usually it's between 90 systolic over 60 diastolic to 120 systolic to 80 diastolic. And hypotension, also these are everything other than the terms are kind of like a side stuff I tell you guys. I never like plan to test this on anything. I just want you guys to know the term, but it's like something I thought like it might be like of your interest too. So just sharing. Hypo means deficient, decreased. Hypotension, so which is the opposite of the hypertension, low blood pressure. So lower than normal blood pressure, which is typically below 90 systolic over 60 diastolic. And millimeter mercury, that's usually the unit of blood pressure. It's also from like, as I kind of said, like a lot of medicine stuff like builds up from like the past long time ago stuff. And back then they used to measure pressure by the how much like the mercury rises once you like have that thing to like make a pressure onto like some kind of syringe. So, but we still use like the milliliter mercury as like a main unit for it. ISO means same or equal. I don't think anyone like calling by the term, but isotension would mean like a normal blood pressure. Prefixes that refer to amount of something. A, N, without or not something. Like apnea. Have anyone heard of that term? Yeah, like A without pnea. That part means breathing. Yeah, correct. So without breathing, it's a temporary absence of breathing. Megalo means large or great. It's like megabytes. It's like pretty big. Oligo is a prefix that means something that's very few or scanty. So oligonucleotides, oligo prefix plus nucleotide, which is a component that composes DNA or RNA. It's a short DNA or RNA molecules with a small number of nucleotide units. I think it's usually defined as like a 20 or less base pairs. So these are some standalone terms that don't have like a Greek or Latin origin. Well, I guess like the end part, like the eon part, that could be like some origin, but the term itself kind of like we define like separately from the Greek or Latin origin. So I kind of like made it so you can like compare a few terms. Sign and symptom, those are like little opposite terms. So sign is an objective evidence of like a symptom. So sign is something you would see as like a physician or like a medical professional. Like you're looking at the patient and I see the sign of like very high fever, high blood pressure. That's a sign. Symptom is usually what the patient or like the person is experiencing and tells you, like, oh, I'm having like a very bad like stomach pain. That could be like a symptom. Congenital. It means something is present at birth, usually genetic disorder. And acute, I want you to compare with the chronic. So acute is something that's very short term and usually very rapid but severe in what happens in your body. And chronic is something that is very long term and usually not that like what should I say, not that severe all the time, kind of like comes on and off, but very difficult to cure. For example, autoimmune disease are very chronic problems. A lot of people have to get immunosuppressants to turn their like immune system down to live with their life, probably for the rest of their lives. Remission is the loss of disease symptoms without achieving a cure. So it could also mean like you still have a disease, but it kind of disappeared temporarily, but it might come back.
So is that just like
You're just in like good for now kind of state. Yeah. Lesion and laceration, that's confused a lot, but lesion is a pathologic change of the tissues due to disease or injury. So any kind of like damage you get to tissues, that's a lesion. But laceration specifically is basically a cut. You get a cut by a paper or like you get a, I don't know, it would be very scary, but like you got cut by a chainsaw. That's a laceration. So usually lesion, laceration is like the stuff that needs to be treated. Like, oh, bless you. it was caused by something else, so possibly infection could happen. So you want to like sterilize very well and like cover it up with like a kind of bandage too. That's laceration. Palpation. Has anyone done some training on like a phlebotomy maybe? Yeah, I see some people. Can you explain like what palpation is? Or have you done like palpating like the veins
Like
before?
when you're like feeling.
Yeah.
Yeah, you're like feeling. Well, in the context of phlebotomy.
Yeah. Feeling for the vein. Yeah, exactly. You were like trying to like examine like something on your body. Could be like some kind of mass or tumor that could be like extruding out of your body. We will go over later too. There's this condition called hernia, which is your body parts. It's abnormally just like extruding out of your body. You can palpate that too, and very commonly, usually the places this term is used is phlebotomy. You will feel for the vein before you like try to like stick your needle in for drawing out blood or giving like IV injection. And this is like a general like tips for learning terminology. So now you know some combining forms, prefixes and suffixes. Like how should you like approach like a? There will be no like such a long term as like the first example you saw, like the pneumono, silicono, that one. But some of them might be like very complicated. So how should you approach it? You start with the combining form because that's the main meaning of the term, and then you look at the prefix. It could tell maybe like it's above or below, like before or after. And then suffix is the last one. Usually only like accessory, so mostly combining form and prefix kind of like defines the whole term. So for example, pericardium is a fluid-filled sac that surrounds and protects heart. So you will define combining form first, which is cardi, that part. Cardio means heart. Peri is a prefix that means surrounding. So pericardio, that already kind of gives the meaning. Yeah, you're surrounding the heart. And is a noun ending. That's how you would kind of like approach like a new term if you don't know the definition. Also, it is very rare, but there are some terms that are exact same spelling, but they mean very different thing. Lithotomy is an example. So litho is combining form that means stone. Otomy, we kind of covered, it's a surgical incision. So lithotomy, surgical incision to remove some kind of stone in your body, kidney stone could be. But lithotomy position is completely different thing. It's something done on mostly like a woman to examine their vagina and their sex organs. So it's like a position they sit in, not any kind of like a procedure. I mean, medical procedure. So yeah, that's the lithotomy position. Kind of like have your legs hung up on like a stirrup, and that's lithotomy as in like making incision to take out the stone. So okay, I took a little longer. Yeah, go ahead.
For the second lithotomy, where do they? How did they point that?
Good question.
The first one has, yeah, the first one makes sense. Litho and anatomy, but how did they choose that first one?
I also don't know myself. I'm just curious, like, so I'm just gonna search up. Okay, so this is a different lithotomy. Okay, I'll
I think at the top it said that that's the position they use.
Oh really? Oh wait, yeah, you were right. Oh, interesting. So it might mean the similar
So
things then.
comes from the
Position they use to remove the stone. Interesting. Yeah, I didn't know that. Interesting. So I guess they're not like completely unrelated. Yeah, then. So I kind of like want to go through like the syllabus real quick. Sorry, I took way longer than I thought on like the review it's like the lecture part, but oh, wait, it's referring to this one. Give me 1 second. Okay. This is like the same syllabus that's on the B courses right now too. And how do I? Is there a way to? Okay. Okay. So yeah, since you guys are already here, I know where the when and where the lecture is happening. I will have office hours like an hour and a half before the each lecture. It's gonna be on Zoom. The link is in the syllabus too. You can just join anytime. I'll be there. I'll probably be getting dinner actually, but feel free to join. I will always be there on Zoom from 5 to 6 every Tuesday. And I kind of like mentioned this before, but this course does not fulfill I guess more like might not fulfill the medical terminology requirement as by many PA schools or nursing schools. It is recommended to take an additional course through the Berkeley extension or through an outside four-year university if this applies to you. So yeah, description, overview, no prerequisites, nothing. So all the lectures, I will record them and post like a YouTube link to it. And I also have like a PDF of the lecture slides always posted in this give me 1 second. In the very front page, I have like a link to the shared folder that I have like most of the things for this course, I think besides the syllabus. So in the slides folder, I will like put the lecture PDF before the class starts. So you can like, if you want to, you can take notes on it. Yeah, there is a textbook that I based all these lectures on. Almost all the terminology that shows up here is from here. This is also the textbook I used for my community college course. It is very optional. Everything you get tested, everything you need to know, it's on the slides, the PDF slides I will share with you guys. But it's very interesting. There are a lot of like explanations about like the organ systems and more detailed like different example diseases related to each organ system too. That would be great. Oh, I ask you guys to bring like a laptop. Yeah, specifically a laptop, not like a tablet on the next or some kind of, I mean it's almost impossible, but some kind of like PC or like a laptop for the next week's lecture, because we'll go through like using this app called Anki flashcards, which a lot of people use for like memorizing stuff. I think it will be helpful for this course too. And that app is only free on laptop. I think it's like $30 on the phone or like tablets. So okay, I'll be very brief, but all the details are in the syllabus. So I advise you to like take a look at it maybe. So every week you'll be having like reading assignments. I set it to 30% because I think these are very important. This is where you will like apply the terms you learned to like the real like life example. I remember one of you guys mentioned that you want to read like academic literature better. Case reports will be the ones you'll be reading, and those are written by real physicians. They report unusual, like interesting cases of like the patients, and a lot of them are very jargon and like medical term heavy. So it will be very difficult to understand at first, and some of them might require like a lot of like a biology or medical like stuff backgrounds, but your goal is not to understand it fully. You just want to be able to like identify the terms you learned in the lecture. I think like at least 10 different terms, yeah, hidden in the lecture, or and at least 5 different new terms or word parts that we did not cover in the slides. And you just write a short paragraph reflection. Oh yeah, this was about this kind of thing, and I really found, yeah, I learned a new term, or like something was interesting about the disease or condition discussed in the report, or there was like a new concept or idea that kind of like sparked my interest. Those are like, it's just very like, it doesn't have to be very long. I said 4 to 5 sentences, but as long as it's not like one sentence, like just very short, I see like no effort in there, I will like take it as like 100%. So I'll also post the PDF versions of the case reports into each assignments in the B courses. Yeah, in the assignment section, there should be like all the stuff uploaded. So I made a lot of assignments, and someone taking this course, who's a friend of mine, brought up it might be like too much stuff for DeCal. I am sorry about that, but this is a pass no pass class, so it's very low stake, and I will make it so that if you try your best, everyone's gonna get 100. Or I guess like if you, unless you don't show any efforts, kind of. Yeah, but I'll attach like a PDF version of the case reports and like the links to it as well. So that's where you will find it. There's no case reports assignment this week. It's gonna start next week. And this is kind of important. So every week after next week, so starting week 3, I will have some of you present about specific organ system. Let's see. This is also in the shared slide, shared drive, but there's a Google Sheet that says like organ system spotlight sign up. I want you guys to take a look at it, and like whichever day you want to present, like put your name in there and the email next to it, and you can present with up to like 4 people. If you want to, you can just present by yourself. That's fine too. But yeah, each week, usually we're gonna go over like 2 organ systems a day, and I want you guys to give just a very brief, like low stakes overview of like what that organ system is. Yeah.
Is there like an outline on the presentation, or should we follow? I think you have listed the first presentation.
Thank you for bringing that up. I almost forgot. I put like an example that I'm gonna use for the first one. First one I'm gonna present. It's a skeletal system, and you will kind of let's see, define what the function of that system is. It doesn't have to be this detailed. Actually, this is like already like too much information. I probably shouldn't have included this much. But more important part is like I kind of want you to maybe choose one like a organ within that organ system and kind of like have like a labeled diagram. You can search a like stomach anatomy diagram and kind of go through each one. Like this is located there, this is located here. We'll next lecture we'll go over like some terms related to like referring where things are, like proximal, distal, abduction, adduction. That could be one thing to kind of like try to use those terms to like describe, oh, so this is like away from that, this is like close to this, kind of like that. I want you guys to like go through like a anatomy diagram of like one of the organs and just give an example of like a disease you could have in that organ system. For skeletal, it's rheumatoid arthritis, more like immune system stuff, but it's inflammation of your joint. Yeah, so I ask you guys to like sign up for this at least like a week before each lecture. I mean, yeah, each lecture this is happening. I added like the date it's happening to. I think it's on the syllabus as well, like the schedule part. And yeah, if you have a slide you're gonna be using, it doesn't have to be a slide. If you want to, you can just like draw it on the board too. That's fine. Whichever way you want to. But if you have a slides, I ask you to like have the sharing settings to be like anyone with the link can access it or view it, and put it in this column. Okay. And yeah, all the details of like the requirements of like what you should be presenting, like how many people, how long. I kind of want you guys to keep it like around 5 minutes. I don't want it to be like very stressful. Yeah, will be in the syllabus. Every like details will be in the syllabus. Yeah.
Are there weekly assignments? Like, is there a reminder on Canvas?
I think it, to me, like it sends me out like the notifications for every what's it called? For every time like something is due like 2 days before, it send me a notification. So I think there should be like a course calendar here too. Calendar. Yeah, somewhere in the yeah. I'll I'll go really quick. Role play project. This something we're gonna talk about very near the end. It also weighs very heavily. It's a kind of like a role play between someone playing as a doctor and someone playing as a patient. I will like get more into it. If you're interested, you can take a look. I'll get more into it near the time. And there's gonna be a final exam. It's only 10%. I just said it 10% because I don't want to stress anyone around final time trying to memorize all these terms. So if you think you're fine, like you don't have to take this test. I'll just like still make it, but you can still pass the class very easily with doing everything else. Also, there's like a schedule with the links to case report articles. September 23rd, we're gonna have a guest lecture from the Greek and Latin department professor, and October 14th, we're gonna have a guest lecture from Dr. Portnoy, which is a supervisor for this course and is a very renowned professor in the field of bacterial research and their relations to cancer therapy. Yeah, kind of goes like that. Take a look at the schedule. These are like the outline of like the how the grade breakdowns go. Total 100 points possible. Attendance. I want you guys to come to every lecture. So I will take up points for any like one who is mixing the lecture. But you can always like contact me if you have like something coming up, or I have like a midterm coming out that day, or I have like a course conflict, or probably yeah, hopefully not course conflict, but some kind of like issues you're having, like some family business. Feel free to talk to me. I'll try to like be very generous with attendance, and I'll not take points off if that's the case. Participation, it's just like I guess it's more like to the case report parts. Usually when we have a case report, the next week, I'm gonna do like a review of that case report. And then at the end, I'm gonna have you guys like do like a group discussions, like what you found interesting, what's the term you guys found. That part, I'll just like walk around, but as long as you speak, it counts as a point. Yeah, and I think the deadline to drop or add the course is September 17th. I think, yeah, September 17th, 11:59 p.m. So, oh yeah, I'll quickly go through. So terms, everything, I think I explained earlier, everything that's blue, everything that's orange, that can be show up on like a final project and exam. And I highly recommend you start like studying them early, but don't stress out too much if you can't. And I want to make a note that a lot of people are still in the wait list. Actually, more people signed up for this course than I thought, which is very thankful of me. But other people are like interested too. So if you are like hesitated, like I'm not sure if I really want to take it or not, kind of like try to make your decision like as soon as possible, so like those people can like come back into the class, take a lecture, and follow the course. Next week, as I said, I ask you to bring the laptop, and it's gonna be about anatomical reference systems, which is like location of body, like proximal, close to you, distal, away from you, and the skeletal system. Yeah, that's it. Thank you.